original professional background is pharmacy. I now refer to myself as a recovering pharmacist. Years ago, though, I started getting interested in health and anti-aging and life extension. And probably about 4 years ago, I got really interested in rapamycin. I'd heard about it when I was speaking at a life extension conference in Las Vegas. I followed it for a couple of years, just kind of marginally. But about 4 years ago, I heard 4 different podcast interviews by some of the top rapamycin scientists in the world. And all of a sudden, I understood the science behind this. And so my interest in rapamycin shifted from interest to obsession. And I decided I had to write a book on it. The title of my book here is admittedly a mouthful: Rapamycin, mTOR, Autophagy and Treating mTOR Syndrome. And see if I can get my slide to advance here. There we go. So this is the story of rapamycin. And so there's been over 25 years of research on rapamycin, trying to discover its mechanism of action, how it works. And that has led to a discovery of the relationship between mTOR and autophagy. So these are critically important topics beyond rapamycin, which is really providing a complete new understanding of cellular metabolism, health, and our aging process. So this is really a revolution in our understanding of the science of life extension. On this slide, I'm showing 2 individuals. On the left image, David Sabatini, who in 1994 discovered rapamycin's mechanism of action. And he discovered in yeast that when rapamycin absorbs and crosses a cellular membrane, it binds with a protein inside all cells. And he named this protein the mechanistic target of rapamycin, or mTOR. And the second image on the right-hand side is Yoshinori Osanami, who in 2016 received the Nobel Prize for his discovery of autophagy. And autophagy is made from the Greek word auto is self and phagy is eating. So it's self-eating. And one thing I want to emphasize is these 2 terms, mTOR and autophagy, are highly conserved genetic traits. They have been in all living organisms since life began to evolve on Earth. And so this is not unique to humans. It's unique to all life forms on planet Earth. And mTOR and autophagy are really counter-regulatory mechanisms that regulate cellular metabolism. So a couple of things that'll differentiate between what mTOR is and what autophagy is. mTOR is a protein inside cells that senses when nutrients are available. And when nutrients are available, mTOR sends out signals to the cells that says, use these signals to build and grow, make new proteins, make new enzymes, build new cellular components. Autophagy, on the other hand, gets activated when no nutrients are available. I use the analogy of sleep because sleep is our rest phase. And yet, there's a lot going on during our sleep phase, and it's the same with autophagy. Although mTOR is a major driver of cellular activity, build and grow, autophagy is the rest phase when no nutrients are available, but still there's a lot going on during autophagy. It's the period and the process of cellular repair and recycling and rejuvenation and detoxification. Autophagy is a major detoxification process for every cell in your body. And the body, in all its infinite wisdom, is able to target old, damaged cellular components, misfolded proteins, and underfunctioning enzymes, and target them for removal. And we call this cellular trash removal, but it may reutilize the components to build new proteins and new enzymes, or get some of this damaged material out of the cell. And that's the detoxification process. So what a lot of people don't understand, autophagy doesn't get the attention that it deserves. Autophagy combats age-associated diseases. It's a key determinant of lifespan for all cells and organisms. We have to have appropriate activation of autophagy, and I'll explain that most of us are not getting that, and our health suffers. So a little about the history of rapamycin. The FDA approved rapamycin in September of 1999 as a compound that can be used by people getting kidney transplants. It was early on discovered that rapamycin suppresses the immune system. It was being researched as an antifungal drug, but when they discovered it suppresses the immune system, all that research stopped in the 1970s. But in 1999 here, FDA approval, when they realized that people getting organ transplants need to be on immune suppressing drugs constantly for the rest of their life. And so that was the first FDA approval for rapamycin. And in the early 2000s, rapamycin got FDA approval for a chemotherapy agent to treat several different types of solid tumor cancers. But these FDA approvals really have worked against rapamycin being recognized as a life extension drug. It's gotten a bad rap because most physicians who are aware of rapamycin only know about it as an agent to suppress the immune system for people who get organ transplants or as a chemotherapeutic agent. And these are not indications where functional medicine docs are likely to prescribe something for patients that are interested in anti-aging and life extension. But rapamycin really got bad rap when it got categorized as an immunosuppressant. It's really an immunomodulator. So it's a really critical differentiation between immunosuppression and immunomodulation. And the big story about rapamycin is that when it's taken once a week, instead of every single day, there's significant health benefits and resulting in lifespan in virtually all species of animals that have been tested so far. So when rapamycin is taken episodically, that's where all the health benefits are realized. And looking at rapamycin and aging between 1975 and 2008, approximately 10 studies per year were published. But moving forward from 2009 to 2016, approximately 180 studies per year. So you can see that research in rapamycin has just exploded. And recent PubMed research where rapamycin is the word in the title of a published article study, 6,507 studies back in 2022 when I researched it, and that number has increased. But you see thousands of articles on rapamycin being published and indexed in PubMed. So here's a little bit about the detoxification process. When things are aging inside cells, these cellular components are isolated in lysosomes, and then there's strong enzymes in the lysosomes that break these things down to their cellular components and either gets them out of the cells or allows the body to reutilize some of the raw materials. For example, amino acids can be reused when proteins and enzymes get broken down. So here's a little graphic that I created to try to show and explain why so many people are out of balance in the mTOR autophagy relationship inside all cells. And so this slide is showing our ancient ancestors, and for 99.9% of human evolution, mTOR and autophagy were pretty much in balance. But balance doesn't mean equal amount of times for mTOR and autophagy. The correct balance for most of human evolution is mTOR being activated roughly about 4 hours per day, and autophagy being activated about 20 hours per day. Because for most of human evolution, people did not get up in the morning and go in the kitchen and open the refrigerator and start to make breakfast. Our ancestors did not eat 4 meals a day. And now we have people eating breakfast, lunch, dinner, between meal snacks, desserts, evening cocktails. So compared to our ancestors, we are eating constantly these days. And here's showing modern humans where people are eating and digesting food approximately 16 hours a day. If you think about 7 o'clock in the morning until 7 o'clock at night, and then that's 12 hours, and an additional 4 hours to digest the final meal that you've had, 16 hours a day where mTOR is being activated, which leaves only 8 hours a day for autophagy. And this is what's happened to humanity. We now have what I call an epidemic of epidemics. I think that the health of humanity is declining rapidly. When I was in high school back in the 1950s, we did not have an epidemic of heart disease and cancer and diabetes and obesity and autism and Alzheimer's disease and so on and so forth. And these days, all of these things are reaching epidemic proportions. And I think one of the major contributing factors to this declining health in humanity is overeating, so that mTOR is getting way overexpressed and autophagy is getting minimally expressed. So again, here's just showing the difference between our ancestors getting 4 hours a day in mTOR activation and autophagy about 20 hours a day versus modern humans where it's way out of balance. So I created the term mTOR syndrome, which is the constant overexpression of mTOR, and that is a fundamental cause of accelerated aging. Overexpression of mTOR causes a dysregulation of cellular metabolism, and that results in a fundamental cause of a wide variety of health problems. So just a list of a number of diseases that have been associated with mTOR syndrome. Remember, mTOR is giving signals of build and grow. And so cancer is overexpression of cells that are out of control. And so overexpression of mTOR is going to create increased cancer risk. And the same with diabetes, metabolic syndrome, cardiovascular disease, obesity, neurological disorders. All of these age-related diseases are associated with the overexpression of mTOR. So I talked about this epidemic of epidemics. So I'm saying that this relationship between mTOR and autophagy, which is so out of balance in most humans today, it's not the only cause of accelerated biological aging, but I think it's a fundamental cause of the underlying health problems that are being expressed on this slide, this epidemic of epidemics. The natural way to treat this condition, the overexpression of mTOR, is calorie restriction or intermittent fasting. But calorie restriction is really not very effective. And there's studies that have been published, and I've got a couple bullet points down here, a meta-analysis showing 80% of people regain their weight loss within 12 months who are just doing calorie restriction. And also, these people regain over 50% of their weight loss within 2 years. And there's the reference for that, those 2 bullet points. But intermittent fasting is a little bit different. It's not focusing on so much what you eat or how much you eat. It's focusing on when you eat. And intermittent fasting is encouraging people to condense the time that they consume calories into a smaller amount of time. For example, noon to 8 p.m. is a 8-hour window. And then you go from 8 p.m. to noon the next day, which is 16 hours without calories coming in. There's multiple different protocols for intermittent fasting. The 16-8 protocol is the most common. Some people do a 2 days of fasting per week. There's several different ways to do it, but the overall emphasis on intermittent fasting is restricting the amount of time that you're taking in calories. This slide is talking about Dr. Joan Manick, who did the first study that was a breakthrough human trial with rapamycin. She did a study, actually, Joan Manick was working for Novartis, one of the big multinational drug companies, and she had the enviable job of being able to research and study anything she wanted. And so she chose rapamycin and aging. She had 218 subjects, age 65 and older. She divided them into 4 groups, and she gave them a Rapalog. This is RAD001 is a compound that has almost identical effects with rapamycin. And she gave these 4 groups of people 4 different doses. One group got 0.5 milligram daily. One got 5 milligrams once per week. One got 20 milligrams once per week. And the 4th group was the placebo group. Everybody took their med or the placebo for 6 weeks. Then there was a 2-week washout period. And then she exposed all of these elderly people to the seasonal flu vaccine. And 5 milligrams once per week was the sweet spot. These people got about a 20% boost in the effectiveness of their immune function. So for elderly people, getting a 20% boost in their immune function, that's a pretty significant outcome. Now, this is the first clinical trial that documented that episodic use of rapamycin at a dose of about 5 or 6 milligrams once per week has some pretty significant health benefits. Here's an animal study that was done on a strain of mice that are bred to get obese and develop type 2 diabetes at a very young age. They started these mice at 2 months of age. One group got rapamycin, the other was a control group, and they went for 6 months. And the rapamycin-treated mice, 58% less body weight, 33% less fat mass. So pretty significant decrease in body weight and fat mass in rapamycin-treated mice over a period of 6 months. And one of the additional outcomes here, improved insulin sensitivity, so reduced likelihood of developing type 2 diabetes and metabolic syndrome. Here's a slide I made on the work that was done by Dr. Vera Gorbanova. This is not a human clinical trial, but I think it makes a pretty strong statement about the importance of rapamycin. Dr. Gorbanova looked at all of the studies on long-lived animals, and scientists have looked at the genes in long-lived animals and identified which genes are associated with longevity and also which genes are associated with accelerated aging. So Dr. Gorbanova divided mice into 10 different groups and gave each group of mice a different life extension drug. And on the left, you can see the list of the different life extension drugs that were used. And at the end of her study, she found out that rapamycin had the largest effect on the gene. And actually, let me rephrase that. She had the negative effect or the minimal effect on the genes that are associated with accelerated aging. And over here on the right-hand side, rapamycin had the greatest effect on activating the genes associated with longevity. So on both sides of the coin, rapamycin reduced activity of genes associated with accelerated aging, and it was activating the genes that are associated with longevity. Here's Dr. Matt Kaberlein, who's initiated the Dog Aging Project at the University of Washington. They're enrolling tens of thousands of companion dogs and following them for 10 years. Dogs get the same diseases as humans, but the unique thing is that companion dogs or pets have the same environment as their owners. So that takes that factor out of the equation. And one subset of these dogs are being enrolled in a double-blind placebo-controlled trial with rapamycin. But dogs age about 7 times faster than humans. They live about 1/7 as long as humans. So Matt Kaberlein is hoping to learn a lot about the aging process from aging dogs, and specifically in the rapamycin arm of the study about how rapamycin affects the aging process in dogs. So my book is really designed to be an accelerated learning course for everybody that wants to use or learn about rapamycin. And so that was my purpose in writing the book. And these bullet points show all the different points that I've discussed in the book. A lot of people can't find a doctor who's willing to write a prescription for rapamycin. So this is just a lot of people will buy my book and let their doctor share it or give it to their doctor so they can educate their doctor about rapamycin and understand that when rapamycin is used episodically, it's very, very safe. I think that over-the-counter drugs like ibuprofen and acetaminophen are far more problematic and have more serious side effects associated with them than the episodic use of rapamycin. So that's my run through of this information on rapamycin. There's a couple other things I'd like to mention. The dosing regime and who should take rapamycin and who shouldn't take it. Since rapamycin inhibits mTOR, and mTOR is a regulator of growth, you would never give rapamycin to young children because that's a time of rapid growth. You don't want to inhibit rapid growth in young kids. And you would never give rapamycin to a pregnant woman because the fetus is the most rapidly growing organism that we know of in humans and time of growth in humans. I want to emphasize that this is a real new frontier. So there's a lot of information that we still don't know. We don't know if 5 or 6 milligrams once a week is the best dose, or maybe it should be in some people 10 milligrams once a week, or maybe in some people it might be better to take 12 milligrams once every other week. We just don't know what the optimal dosage is for people, but the Joan Manick study told us that 5 to 6 milligrams once per week is a very safe dose, and I'd say probably 85 or 90% of the people taking rapamycin are probably utilizing that dosage regime.
Where do we get it?
Another thing that, go ahead, you got a comment there?
Yeah, where do you get the rapamycin?
Yeah, well, rapamycin is a prescription drug. It's FDA approved. So for quite a while, I was getting my rapamycin filled at my local Rite Aid store, and just chain drugstore in the United States. But I will mention that I first took my initial rapamycin script to an independent pharmacy here in my hometown. Pharmacist looked it up and said, yeah, it's available, but I'm not going to order it for you. It's a pretty expensive drug. Costs thousands of dollars for just a single bottle of 100 tablets. And he said, you're going to get a few tablets filled in your prescription, and I'm going to have all this money tied up in my inventory that's not moving. So I took it to rapamycin, my rapamycin prescription to Rite Aid and local chain drugstore, and they didn't have any trouble ordering it and filling it, and I get it filled on a regular basis there. The other thing that I talk about in the second edition of my book is that there's now a really reliable generic form of rapamycin called Rapapro. And there's a company called International Anti-Aging Systems. The company was formed by a couple of Brits who actually live in Hong Kong, but since the mid-1990s, they have been specializing in making hard to obtain life extension drugs available through their internet site around the world. And several years ago, they got interested in rapamycin. They contracted with a reputable Indian pharmaceutical company that's utilizing a new form of technology with nanotechnology. And they have a proprietary generic form of rapamycin called Rapapro. You know, actually, I just realized I'm not supposed to talk about proprietary products on this continuing education program. So I better stop there. I don't want to violate some of
As
the,
long as long as you identify it as such, I think we're okay.
okay, yeah, well, I'm not marketing it. This is not my product, but
Got it.
it does give people who can't find a doctor who will write them a prescription for rapamycin. It gives them the flexibility to go online and order a really reputable generic form of rapamycin called Rapapro. I've ordered this product. I've taken it myself. I get my blood tests done, and that verifies that it's very well absorbed, and I get very reputable plasma levels. And want to mention that rapamycin is the name of the drug. The generic name is sirolimus, Sirolimus. So when you go to request a blood test with LabCorp or one of the other blood draw facilities, you want to request the blood test for sirolimus. And since it's an FDA approved drug, many insurance companies will cover not only the prescription when you get your prescription filled, but also the cost of getting a blood draw.
Can you spell that again?
The name of the drug,
Yeah,
or
sirolimus, SIRO.
yeah, sirolimus is spelled Sirolimus, sirolimus.
Dr. Ross, when you mentioned about blood testing, so you're basically just looking at the levels of sirolimus in your blood. Are you
Yes,
also going to
that's
be checking other metabolic parameters for you to see how your rapamycin is actually affecting the other organs as well?
That's a good point to bring up. I'm glad you asked that question. I encourage people to get a good basic lab panel before they start rapamycin, and then periodically get follow-up blood tests to check and see if there's anything that's changed. A couple of things that can happen in some people. Some people will get lower levels of iron and hemoglobin. Some people will get a bit of an elevation of triglycerides. These are not serious side effects. They're easily manageable. And a rapamycin scientist named Mikhail Blvd, he's a Russian scientist, he's made the comment that in the elderly, he thinks that not taking rapamycin is a more serious health risk than smoking. There's just so much benefit to taking rapamycin, because when you take rapamycin and you partially inhibit mTOR and start to activate autophagy, every single cell in your body starts to work better. So it's really quite a remarkable outcome. And many people ask me, well, how am I going to tell it's working? What am I going to feel? And my answer to that is that you need to understand the science. And on my website, I say that I'm bilingual. The two languages that I speak are English and science. Many people get put off when they see the terms mTOR and autophagy. They think this is going to be too complicated. When people read my book and they get exposed to those terms a dozen or so times throughout my book, they will understand it by the time they've gone through my book. It's not complicated. You just have to get exposed to it. So I'm not sure where I was going with that particular thought, other than the fact that people who speak English can easily understand what I've written about here.
So when you mention those side effects, do you just lower the
Oh yeah, thank
dose? Do
you.
you
Back
stop
to the
it?
side effects. The most common side effect that people experience is a painful or irritating little mouth ulcer, aphthous ulcers in the inside of the mouth. I'd say maybe 5, at the most 10% of people might occasionally experience that side effect. In most people, it goes away within a few days. I've only heard of a couple of people that repeatedly got these aphthous ulcers. So the side effects from rapamycin are minimal. Aphthous ulcers, maybe a little decline in hemoglobin and iron. You can take an iron supplement, maybe a little elevated triglycerides, but these are minimal side effects and easily managed. compared to all the benefits that you get, I think this is really a revolution in life extension and anti-aging.
Well, to be honest with you, when I saw your presentation before, that kind of triggered me to start using rapamycin myself. So that's why I definitely, again, I'm taking other things with it, but when you mentioned about the balance of mTOR and also how rapamycin kind of puts that down, that definitely entices everybody who's in the senolytic world or autophagy world to get into it. And
Yeah.
one of my curiosity, I don't know if you're familiar with the drug dasatinib. It's an anti-cancer medication, along added with quercetin, which is a bioflavonoid, is being used as a senolytic drug, which is also being used as, of course, the function of autophagy. And of course, immunosuppression, as you mentioned, is one of the effects, or I mean, the use of rapamycin. I don't know if there's some similarities with this dasatinib quercetin combination with rapamycin. Have you have any readings and studies about that?
There are some synergistic effects. There are a number of different senolytic agents, and you can use them along with rapamycin. And I didn't finish one of my former thoughts here. People ask me, how are they going to tell this is working? And my response to that is, if you take a dose of vitamin C today or a dose of vitamin D, how much different do you feel tomorrow? You really don't feel that much different, but you take these things because you know they're important. And when you understand how rapamycin works and how important it is to get activation of autophagy for rebuilding your body, then you start to understand why rapamycin is so significant. And although intermittent fasting is the natural way to do this, many people are not going to discipline themselves to do intermittent fasting. And this is what rapamycin does for you. It mimics the fasting state. It inhibits mTOR. And so, but I advocate that, and I'm sure many of you do this, I think we should do everything that we can to improve our health. So I do intermittent fasting along with taking rapamycin, and exercise regularly and eat a healthy diet. I mean, all of these things are critically important for achieving healthy longevity.
Is there a time during the day that you take
Good point. Good
rapamycin?
point. Thank you. Rapamycin is a lipophilic agent. It is fat soluble, and we don't absorb fat soluble substances too efficiently. So you will get improved rapamycin absorption if you take it at a fat containing meal. So that's and one other thing I'll mention to you, if you follow the literature on this, there's also a compound in grapefruits called naringenin. And naringenin gets metabolized in the same pathway as rapamycin. So if you eat grapefruit or drink grapefruit juice along with your dose of rapamycin, part of that pathway is going to be occupied by the metabolism of naringenin, and it'll slow down the metabolism of rapamycin and increase your blood level of rapamycin. A good place that I want to make sure that you're all aware of, there's an online forum that is the most complete site for up-to-date rapamycin information. It's called rapamycin.news. That's the website, and you can go there, and there's just an enormous amount of information. There's a search feature, so you can put in a search term and find out dozens of articles and people commenting about different questions. And so it's a wonderful resource to go to, rapamycin.news.
Dr. Pelton, you're saying take it with grapefruit so it can actually increase the levels. It can be prolonged in the system.
Yes. Taking grapefruit or drinking grapefruit juice with rapamycin will increase your plasma level of rapamycin.
Plus, adding that fatty meal increases the absorption. So those combinations can enhance the levels of your rapamycin, basically. Is that correct?
Yes, yes, that's correct. But and I really encourage people who are taking rapamycin to get their blood levels tested. And on average, you want to get your blood test done about 20 to 24 hours after taking your rapamycin. and track your plasma levels. It's too problematic to try to get to a phlebotomist like 30 minutes or a half an hour after you take a dose. So a lot of people in the rapamycin community are suggesting get your blood draw like 20 hours to 24 hours after you take your dose, and then track your levels.
So you're not worried about any liver or kidney toxicities for this?
Not at all. It's going to help everything work better. I've not seen anything about liver toxicity or any type of problem like that. The only problem is taking too high a dose, taking it too regularly. It should only be taken once a week or episodically, because it will suppress the immune system if you take too high a dose or take it too frequently.
Because why I ask is I have some patients who's taking rapamycin because it prevents their sarcopenia. So that's why when you talk about these age groups, these are the organs that are actually going down first. And when I want to monitor other metabolic, this is one of my questions for you. Should we monitor like HSCRP or A1C? I mean, on the literature, is there something that we can keep an eye on in terms of how it works?
I certainly advocate people to check those markers, but the main things to keep an eye on are iron levels, hemoglobin, and triglycerides.
So you all know what I'm going to ask next. What effect does it have on the hormones?
I haven't seen anything written about that. I don't think there's any negative effect on any of the male or female hormones.
All right, Dr. Renario, we got our next assignment. Right.
Yeah, he's the hormone guy, Dr. Pelton. So he's
Yeah.
always on hormones.
So that's going to be our next.
I will say that in the second edition of my book, and I just got an email today notifying me that the printer is starting to do a third print run. So that's just gratifying to me that the second printing is just about out and the printer's doing a third print run. But when I wrote the second edition of my book, I increased the amount of information in the book by about 40%. And one of the things I did in the second edition is write a chapter about sarcopenia. And in my research for that chapter, one of the things that became quite evident is that the US recommended daily allowance for protein intake is set way too low. And this is especially problematic for elderly people because as people age, they generally eat less. But as we age, we probably should be consuming more quality protein. And this ties into sarcopenia. And so in that chapter, I wrote about protein, dietary protein, and strength training, and rapamycin. And all three of those things will influence and slow down the process of developing sarcopenia and or reverse some of the symptoms.
Dr. Pelton, I see a lot of cancer patients. And as you all know, as on part of your slides, mTOR is actually a driver for cancer. So I'm talking about, can active cancer patients take rapamycin while they're doing therapy? Or is that something that you would suggest to take after or in the future instead?
Well, this is a difficult situation because oncologists generally have standards of practice that they have to adhere to, and rapamycin is totally outside the box. But keep in mind that there's an association between the overactivation of mTOR and cancer. And mTOR has been FDA approved to treat several different types of solid tumor cancers. So I think that cancer patients would probably benefit from taking rapamycin even when they're undergoing chemotherapy. But there haven't been any studies on this, so you're going out on a limb, and it's probably a little too risky for most doctors. But it's a difficult situation because I think that there would be benefits, but we haven't done any studies in that area, so it's just too problematic in our age of lawyers and our litigious society to take the risk. But I encourage people to read my book and get educated about rapamycin and make their own decisions.
Yeah, I guess I'm just so fortunate that I work with an integrative oncologist, and he's more open to using these natural therapies because I know what you're saying. You do get the stink eye from other oncologists or even other conventional docs
Yeah.
when they see these natural therapies on the med list or supplement list of patients. I mean, even just plain supplements alone gives them the raising the red flag type of feeling. So we get a lot of smack from them, but again, this is just more of a privilege that I have, and to see how natural therapies actually helps even ongoing cancer therapy.
Yeah.
So, but you're right, we need to get educated. Other practitioners needs to be educated about this because there's so many wonderful things about rapamycin. I
Yeah.
agree.
Let me tell you about another study that was recently published. This is a mouse study, but it also talks about aging and how our immune system declines with aging. They took a group of mice, young mice, and divided them into two groups. One was vaccinated, the other was unvaccinated, and they then exposed them to a lethal dose of an influenza virus. 100% of the vaccinated mice survived, and all the unvaccinated mice died. The second part of the experiment, they used 24-month-old mice, elderly mice, and they were all vaccinated. They divided them into two groups. One half of the group that was vaccinated was the control group. The other half was vaccinated mice that took rapamycin. The vaccinated mice that got rapamycin and then were exposed to a lethal dose of the influenza virus that would kill 100% of unvaccinated mice. 100% of the rapamycin treated mice survived, whereas 75% of the vaccinated mice, elderly mice that were not treated with rapamycin, died. So again, elderly mice who are vaccinated getting exposed to a lethal dose of the vaccine that would kill 100% of unvaccinated young mice, 75% of them died, whereas 100% of those mice that were vaccinated and received pretreatment with rapamycin all survived. So powerful statement about the decline of the immune system in the elderly, because these were elderly mice that were vaccinated, and yet 75% of them died. And then rapamycin treatment, 100% of them survived.
Do you have any extrapolations for human life at all?
Nothing like that's been studied in humans yet, but what I'll do after this presentation is send you a link to that study so you'll have that information.
Do
Does
you
your
have
book,
any head-to-head comparison with other anti-aging drugs such as Urolithin A or ashwagandha? Was there any head-to-head study or even, I guess, literature about which one's more effective, which one's less?
No studies on any of that. This is a really new area, and it takes a lot of money to do clinical trials. And rapamycin is now a generic drug, so most companies aren't going to fund studies on it because it's not a study that, not a product that they can have a proprietary use of. It's the patent on it is expired.
you have a list of what you consider quality protein in the book? Because it's hard to find good protein that's clean.
I'm sorry, what was that, the list you're asking about again?
Quality protein. I'm old and I have a hard time getting enough protein because most of the meat is, not
You
contaminated.
say quality protein?
Yes.
Just grass-fed beef and cage-free chicken and eggs, and I mean any quality protein like that. I also do a whey protein shake once a day to increase my protein intake, because there's good documentation now that documents that in the elderly, our ability to synthesize new muscle protein declines. But if you take an additional protein supplement, you can counteract that decline in muscle protein synthesis. So it's especially important for the elderly to consume more quality protein. And for me personally, since I've been studying this, in addition to eating healthy protein supplements, I also do a whey protein shake most days.
Thanks.
Oh, Dr. Murray, something that I probably can advise you about. In the recent IFM conference, they were pretty big about, so this is Dr. Bill's area of expertise, estrogen. So there is a program that they're recommending now for women who are in the reproductive age. From day
yeah,
1 to 14 would be high estrogen, right? And estrogen is known to actually build muscle. So they are promoting now resistance exercise like HIIT, weightlifting, weight training, to be done on day 1 to 14. But again, for postmenopausal women, that's why the problem of building muscle is actually there, because estrogen is not there. But when you do your hormone replacement therapy, that becomes a game changer, because they had studies that muscle mass actually increased when estrogen is being used by a female. That's why how important hormone replacement therapy is, not only because we want to regulate the hormones for women, for bones, right, for mood, but now there's a lot of new studies about muscle mass not only being dependent on food, on even on other supplements, but estrogen and muscle has a big correlation now.
Yeah, you're right. Absolutely right. And another thing, some recent studies on rapamycin has shown that it delays the onset of menopause. And we know that when menopause sets in, there's accelerated aging in women. So rapamycin's ability to delay the onset of menopause has two different benefits. One, it will allow women to conceive children at a little older age if they want to, because more and more women are wanting to have careers and get financially secure before they start to have a family. But also it's likely by extending the reproductive years and changing the rate or the time when menopause starts to occur, it's probably going to translate into some life extension for women.
So we're going to give more customers to our OB-GYNs out there, and they're going to be seeing higher risk of pregnancies when they use rapamycin, basically. But that's a good thing, Dr. Pelton. That's nothing against rapamycin.
Yeah.
So, a question in the chat is, what levels should we track? Blood levels, I guess, or the sirolimus.
Well, you want to track your sirolimus levels, but also you want to check your iron, your hemoglobin, your triglycerides. These are things that have been shown to possibly be altered a little bit when people are taking rapamycin. So I would advocate people to be checking those.
I think, Dr. Pelton, do you have any suggestive range, or we just follow the lab range like in lab or Quest, or do you have a specific sweet spot people should be in?
Roughly about 1 nanogram per milliliter. So if people are doing a 6 milligram dose once per week, if they get a lab test about 20 or 24 hours later, they should be 4, 5, or 6 nanograms per milliliter in their sirolimus dose. That's rough, but it's again variable with different people. And I'm sure that when we study this more, we'll find that there's significant biochemical individuality in how people absorb and metabolize rapamycin. So there's really no definitive answer on a lot of these things yet.
Do you have an estimate of the cost of this? What this costs? A month or?
It's a pretty expensive drug if people don't have insurance. When I get it filled at my chain drugstore, Rite Aid, it's a $20 per month copay. And for the Rapapro generic that I mentioned that's being manufactured with nanotechnology, it's roughly about $30 per month for the standard 6 milligram per week dose. So it's pretty reasonable.
Okay. Are you getting it covered on insurance?
Yes.
Is that Medicare?
An FDA approved drug.
Is that Medicare?
I have Medicare and a supplement.
Got it. Thanks.
Somebody here asked about cancer cells utilizing cellular components from autophagy as fuel. I have not read anything about that, so I don't have a response to that.
Right, that was the other, yeah, that was the other question.
Dr. Pelton, what's the diagnosis code that we can use for it to be covered?
There isn't one because it's not approved for life extension and anti-aging, but my doctor just writes a prescription for the sirolimus blood test and writes on the face of the prescription that it's good for 6 months. And I make copies of that. And every time I go in for a blood draw, I just take a copy of that prescription and they draw my blood and I get my blood levels.
You might want to try R62.7 is failure to thrive, adult failure to thrive. Would that cover it?
R62.7.
R62.7 is adult failure to thrive. I use that for IGF-1 levels also. So,
Okay. Thank you.
so that might cover it.
Yeah.
In case you have to do that. So I looked it up in
Yeah.
the generic lab that we send our patients to, and it's $122 for the sirolimus test.
Ah,
And there's another, they have it bundled with tacrolimus or tacrolimus. There's, you can get a sirolimus tacrolimus test also for $158. Would you know why they would bundle those two together?
no, that's another Rapalog. That's new to me. But again,
They're both immunosuppressives. They're commonly used.
yeah. But I use my Blue Cross Blue Shield insurance and there's no charge for my phlebotomy.
Okay, so there's that. All right. So when we order this, if you get it from Rite Aid or CVS or something, and they it's usually a fixed dose. It's not like a compound, right? Where you can.
Correct. And there are compounding pharmacies that are making this, but I just get a generic form. There's a number of different generic brands available. The one that Rite Aid carries is Dr. Reedy, Reedy, I believe. But then I've started ordering the Rapapro from International Anti-Aging Systems, and I've done my blood tests and find out that that's actually better absorbed than the generics. And they've done some testing and find out that the Rapapro is better absorbed than the brand name Rapamycin, which is produced by Pfizer. So
the commercial availability is in a 0.5 milligram, 1 milligram, and 2 milligram tablet.
Yeah, 1 milligram and 2 milligram are the most common dosages available.
Okay, so you said you take 5 milligrams?
For a long time, for about a year and a half, I was taking 6 milligrams once per week. For the last 6 months, I've been taking 12 milligrams once every 2 weeks. And just kind of an experiment I'm doing. I'm thinking a higher dose is going to give me a little more activation of autophagy. And I haven't noticed any negative side effects. So that's just my own personal experiment.
Well,
Dr. Pelton, so in your personal experience, what have you noticed in your own system?
I noticed when I first started taking rapamycin over a period of about, I'd say, 2.5 or 3 months, I lost about 8 or 10 pounds, basically primarily visceral abdominal fat. And the animal models that have been done show that this is primarily where the fat loss occurs in animals taking rapamycin.
So it's like a weight loss drug for you then?
Yes. One of the slides I showed was the diabetic prone mice gaining far less weight and having far less fat mass than the control group.
Oh, so you don't have to do the Ozempics anymore or the GLP-1s. Let's just do the rapamycin then. Less side effects, right?
Yeah.
Wow.
no, there's no fun. There's no fun
I
in
mean,
that.
it's by blocking or inhibiting mTOR, it is a fasting mimetic. When you fast, you don't take in nutrients, and that's basically what mTOR is doing. It's inhibiting mTOR.
But you but you did say it'll work well with other weight loss modalities, right? It's not like it's gonna overdo the weight loss from the sound of it, because you're doing intermittent fasting as well, as you said.
Yeah. These new weight loss drugs drive me a little bit crazy. I mean, it's a multi-billion-dollar cash cow for the pharmaceutical industry, but they're not teaching or encouraging anybody to exercise or to eat more healthfully. So I have a really kind of a negative approach to a lot of those things. But they're out there and gathering steam.
Yeah, well, we do that. That's our job.
Yeah.
So that's part of what we do. So
Yeah. I mean, and I really think that I just emphasize so much how important regular exercise and a healthy diet are. I tell people that if they're a junk food junkie, taking rapamycin is only going to be minimally beneficial.
You can't cheat your way through it, huh?
Yeah.
Well, I wanted to address Dr. Steve here about the cancer question. Because when we do IPT with our patients, we do promote fasting. So, I mean, the reason for that is not because of autophagy, but it's because we can lower the blood sugar faster doing IPT. But the thing here is we do not promote fasting for patients who are basically cachectic. So in this situation, promoting more autophagy can possibly be the one that applies to the statement that Dr. Steve mentioned here, that when autophagy occurs, this can be now fuel for cancer. Just because being stage 4 in cachectic shows you the aggressiveness of this cancer, and it's basically using everything around it as energy to basically destroy all the other organs. But in stages of stage 1 and 2, definitely intermittent fasting and autophagy is something that we still promote, and we do get the results that we like when applying IPT, supplementation, dietary changes, and also promoting autophagy. So just to kind of give clarification to that in terms of clinical experience.
Well, yeah, again, I don't have a lot of clinical experience with this because I don't have a patient practice. But regarding Dr. Steve's comment about cancer, the other side of the coin is to realize that rapamycin has received FDA approval as a chemotherapy agent for several different types of solid tumor cancers. So it is being recognized as something that helps inhibit cancers. And I want to go back to autophagy for just a minute. There's an analogy that I've created to try to express how important it is to get some activation of autophagy. And I use the example of a car with a flat tire. And the thing I emphasize is that you can't put a new tire on until you take the old tire off. And that's where autophagy comes in and is really critically important. You have to have this period of autophagy to break down old dysfunctional proteins and enzymes and other cellular components. And then the body can utilize the available nutrients to build healthy new proteins, enzymes, and cellular components. But you've got to be able to break down the old ones and get rid of them so that the body can build new ones. So
okay. All right. So how long have you been using the rapamycin? A year, 2 years, 10 years? We can't hear you.